Hey guys, Moisan here. Okay, ko pa. So guys, I'm planning to do a monthly I should say like update or a monthly update of using finasteride and minoxidil. So um it's gonna be like a Q&A thing that I'm planning to do. So instead of doing it like every 2 weeks or 3 weeks, I just decided to do it every month. Okay. Basta kapag day off or things like that. So if you guys have any questions, feel free to ask me anything. You know, so if you guys have any questions with minoxidil and my experience with finasteride, just feel free to comment down below. And yeah. At syempre, hindi mawawala, guys, say hello to Juve de Gracia and Osid Ginao. Guys, I miss you so much. I've been very busy with my school and work, so I don't have so much time to do a finasteride and minoxidil content, but I do have a two contents that I'm currently editing right now. So baka i-post ko yun soon, depende. It depends on how busy my schedule is. Okay? So yeah, we're just gonna be here for an hour or so just to help, answer some questions. If you guys have any regarding my experience or whatever. So I'll just be here drinking my tea at masyadong mainit dito sa room. Hindi ba pangit yung sound? Hindi naman pangit yung sound. Okay, actually, let's put this thing over here. I'm just trying to organize my screen. 6 minutes na agad yun. So guys, it's been 2 months that I have been using my minoxidil. Okay. I think 2 months or 3 months. I don't, I think 3 months now. And surprisingly, I thought that I was not gonna have a side effect, but actually I did. And the side effect that I have actually encountered, I naglagas talaga yung buko. Guys, I was having hair shedding with minoxidil. Actually, I want to do a content on that. So I was having hair shedding with minoxidil 2 weeks after I used it. So I wasn't, I mean, I didn't really got scared. Hindi naman ako talagang natakot. But then, madami siya. Nag-shed siya like, siguro like, yeah, 2 weeks or 2.5 weeks. I can't remember. And then after that, much ano na yung hair ko actually, much parang actually maganda talaga siya sa the effect was actually very good. Hindi na siya nag-hair shedding ngayon. Um, yeah, maganda yung effect ng minoxidil. Yun nga lang nag-hair shedding talaga after 3 weeks of using. So far okay naman. With the 2% solution that I'm currently using, I'm very happy with it. So I'm not gonna go and do a higher dosage. Like I'm not gonna change it to 5% foam for now. So I will stay with 2% solution. Okay, maybe um I don't think I would be using the 5% solution soon. So for now I'm still using the 2%. This is the minoxidil solution that I am currently using, guys. That's it. Can you guys see? So the effect is actually very good. It's just that I was scared because I was having hair shedding. That's it. And actually with minoxidil, I find that the hair shedding that I experienced with minoxidil is actually worse than when I first started finasteride. So that's one thing that I can actually compare with minoxidil and finasteride. So natakot talaga ako natakot ako dito sa minoxidil kasi ang lakas nung lagas. But anyways, I'm okay with it. I'm satisfied with the result. So for now, I still continue using it. So ayun, okay naman. So far okay naman ang hair lalo. So guys, if you have any questions, feel free to jot it down, put it in the comment section down below, say something. Okay, so a lot of you guys are actually sending me message in my Instagram and Facebook. So sometimes mahirap for me to answer them kasi nga yung schedule of my school and my work. So I may reply late, and so I think this is a good chance na maglagay kayo ng comment and ask me anything. Do you guys have any specific content that you guys want me to do a review on. I'm losing thing. Nauubusan ako ng content, guys. So I don't know what to write anymore. Ay. Hmm. Guys, by the way, I only have one finasteride left, and I called the doctor this morning to get a refill of finasteride. So tomorrow, since it's not urgent, I don't need to see the doctor. Um, I made a phone consultation. So what's gonna happen is they're gonna call me tomorrow at around 10 a.m. and they're gonna refill my meds. They're gonna send the prescription to the pharmacy. The pharmacy would then call me after I don't know how many hours, and I'm gonna go and pick up my new set of finasteride for the next 3 months. So before I go to Philippines this October, I may have to get another refill. Kasi in Philippines, I cannot get I cannot get the medication. And so, I'm gonna make sure na meron akong gamot pag uwi ng Philippines. Kasi dito sa Canada, it's different than in the Philippines. We need a prescription here. Sa Philippines, nakakakuha sila ng they can actually buy finasteride without doctor's prescription. And I did a video on that. So, yeah. So let's write it here. Um, you know. You know what, guys? I'm gonna read some comments in my videos, and I'm gonna answer them right now. Okay, so I'm gonna go back to my previous videos that I did. So other viewers actually put some comment in there. So sasagutin natin yan in both English and Filipino. So let's first start with tingnan natin dito. Actually, a lot of the comments are very interesting. So, so may mga comments din dito eh. Okay, so there's one comment here from the video that I did, and this is the finasteride sa Philippines and at bakit kailangan ng reseta ng doctor. So I did this video, and there's one question here from Great. Ang sabi niya is effective din po siguro kapag gawing 0.50 milligram yung Propecia para medyo makatipid. Hehe. So, effective naman ang 0.5, wala namang problema yun. It's just that it's lower than the standard dose. So yung standard is 1 milligram, di ba? So yung expected mo na result, kasi usually with 1 milligrams or with 1 milligram ng finasteride, usually you'll get the result in a matter of, you'll see a result or an improvement in 2 to 3 months. Pero kapag 0.5, which is kalahati lang siya, siguro it may take a little bit longer. Okay, and yung iba kasi, um, they're making it into 0.5 milligram para makaiwas sila sa side effects, thinking na kapag lower ang dose is much lesser ang side effects. So actually, kahit naman lower ang dose, kung if your body is actually sensitive to finasteride, you may or may not have a side effects. Okay, so regardless naman yan, kahit half a dose lang or 1 milligrams, possible pa rin na magkaroon ng side effect. Okay, so yeah, but if you want to save money, kasi nga sa Philippines mahal ang finasteride, di ba? For me, I think it's much better ask your doctor first kung okay lang ba na ano, kasi yung ibang doctor, hindi sila pumapayag na hatiin ang 1 milligram to 0.5 unless nakikita nila na hindi kayang i-tolerate ng katawan mo or may side effects ka. So that could be some reasons na ililesen ng dokta ang dosage ng finasteride mo. But 0.5, I think okay lang yan. Okay, so the next question is, this is from ano to? Aesthetics. Yeah. Sabi niya, hello po, I just went to my local dermatologist, and after the consultation, I asked if I can take finasteride, but she was opposed to the idea and instead gave me the shampoo and cream that will stop hair loss. But I am very hesitant about this as it's not really treating the main problem of hair loss. Should I visit another dermatologist for a second opinion? I mean, if you're looking for a second opinion ng doctor mo, why not? Kung may time ka, there's really nothing wrong with that. But I'm pretty sure na yung doctor kasi na pinuntahan mo, baka based on her assessment, it's not male pattern baldness. It could be some other underlying conditions, or baka I don't know, we don't know, baka ibang klase ng different types of hair loss na madadala naman siya with shampoo and or cream. And ano bang cream yung nireseta sa'yo? Kasi sabi mo dito, it's just a shampoo and cream, so you did not specify kung anong klase ng cream. Is it a medicinal cream or anong klaseng cream yun? Yeah, so if you want, I mean, kung may time ka, by all means, go and see a second dermatologist. Wala namang problema doon. And isa pang question from Kenneth Del Mundo. Sabi niya, saang doctor po ba pwedeng magpatingin about sa hair thinning po? Kasi talaga nade-depress na ako sa buhok ko. Thanks in advance. So, this question, hair loss is very depressing actually. Ako na halos ma-depress din ako for my hair loss. And anong klase po ba ng doctor pwede magpatingin? First, you go and see your family doctor as I mentioned in my video. First, see your family doctor kasi sila basically nakakaalam ng medical history mo. And then based on your family doctor, sila yung magde-decide kung kailangan kanilang i-refer sa dermatologist. As we know, dermatologist is a specialty doctor that looks after skin, hair, and nails. So based yon sa assessment ng family doctor mo, kung kinakailangan pa ng further assessment, i-refer ka sa dermatologist. Okay? So dito kasi sa Toronto, sa Canada, kailangan naming magpakita muna sa family doctor, and then family doctor ang magde-decide kung kailangan ba namin pumunta ng specialist such as a dermatologist. Okay? So, I recommend na see your family doctor first. And I hope I answered that okay. And wag ka ma-depress, okay? As long as you start early, the chances of regrowing your hair is very high. And ano pa, sabi ni Ashling, Meron siya ditong question, sabi niya, "Hello po, Finasteride lang po ba yung ginagamit niyo to combat hair loss po?" No, if you are up to date with my videos sa hair loss journey, I first used Finasteride and I am currently using some um, anti-hair loss shampoos and tonic and stuff like that just to support the medication that I'm currently taking. And I just recently started using minoxidil. Okay, so it's been my third month and um, it's been doing good in my hair. So I'm happy about that. Okay, so another question is this is from who's this? Junaid Nasroding. Junaid Nasroding. Nagkaroon ako ng receding hairline tapos nagpanik ako na baka pagtawanan ako ng mga tao. So ang ginawa ko, di man lang ako nagdalawang isip at nagpa-hair system install ako at shinave nila hair ko para ma-install yung fake hair. You know what? May mga nakikita akong gumagawa nito, shini-shave nila yung hair tapos pinapalitan ng nilalagyan ng artificial. That's actually may mga patients kami na gano'n. Those patients who have actually undergone like chemotherapy, naubusan talaga sila ng buhok, 'di ba? So naglalagay sila ng gano'n. And then after a day, grabe yung anxiety ko kasi sobrang sisik ko. Di man lang ako nag-research ng alternative way para ma-cure ng paglalagas ng hair ko. That's okay kasi for the first time naman na maka-experience ka ng hair loss, natatakot ka. And another thing is takot din tayo magpa-consult sa doctor kasi nga baka mamaya kung ano yun, di ba? And then, but it's really much better to always see a doctor kasi mas proven and effective way ang kanilang treatment. They can give us a medications and things like that. And of course, proper assessment is done. Normal yun na magkaroon tayo ng anxiety, syempre. Pero we have to think positive that there is a solution for hair loss as long na it is still early and it is properly diagnosed and treated. Okay, so ako nga nun eh, 'di ba, when I first having hair loss, I actually went to use a lot of like herbal stuff, herbal supplements, which apparently did not work for me. So, and then nung talagang medyo sabi ko, okay, enough of this herbal stuff, herbal medicines and supplements. I have to see a medical doctor. So, ayun, awa naman ng Diyos na agapan, di ba? So sabi niya pa rin dito is niresetahan ako ng Finasteride 1 mg at pang 3 days ko and na ngayon. Kaso medyo expensive ang per tablet ng Finasteride kasi 72 pesos ang isa. Actually, that's expensive sa Philippines ang Kahit naman dito sa Canada, Finasteride is very expensive. It's not covered by our um, what do you call this? Like benefits, like work benefits or health insurance kasi it's considered a cosmetic medication. Okay, so it is expensive. Kaya nga, if you're planning to use finasteride, you have to be financially ready din kasi sobrang mahal din talaga siya. And kailangan mo ng budget for that. Sabi niya dito, but I'm planning to get the Finasteride 5 mg kasi mura siya, 25 pesos lang at hatiin ko na lang sa 4. Like I always say, ang 5 mg Finasteride is for prostate only. It's Proscar. Okay, so pag hinati mo siya, it's 1.25. Overdosing yun. Okay, so kailangan alam ng family doctor mo or alam ng prescribing doctor na 1.25. Alam ng prescribing doctor kung bakit 1.25 ang kanyang ipini-prescribe. Kasi para sa akin, ako lang ano yon, it's overdosing talaga yon. So, the best pa rin magpa-consult ka sa doctor and take the actual dosage of medication for a specific medical concern. I know it's expensive, but what can we do, di ba? So, those are the comments that I got from this video. Yung sa last video na ginawa ko. Now, I'm gonna read some comments here. So, ang sabi ni Juve de Grace is, dito sa atin sa Philippines, pwede tayong dumiretso sa derma, carry lang naman. So, according to her, so you can go to the dermatologist. No, actually sa Philippines 'yun, but dito kasi sa Canada hindi talaga puwedeng dumiretso sa dermatologist kaagad. That's my understanding. Kailangan talaga ng referral ng family doctor. So sabi rin ni Kerry lang naman. Sabi din ni Juve de Grace is Kerry lang naman sila na ang nag-a-access. Expensive pa kasi magpa-consult sa family doctor. Okay. So, yeah, ibang-iba kasi ang medical system dito. Dito, libre ang consultation with your family doctor and sa dermatologist. So, kapag nagpa-consult ka sa dermatologist and um, ang concern is actually like a medical issues, medical problems, libre na yon. But I think some dermatologists will make you pay kung ang concern mo is about beauty or things like that. So, babayad ka ng consultations nila. So, let's answer some few more questions. Okay, may mga nare-receive pa rin ako dito eh. Tingnan natin. Okay. So this is from the video that I did, and the title is "Why am I starting minoxidil 2 years later than finasteride?" So this is another video that I did. So I'm gonna go ahead and read some questions that I got. So I'm gonna, I've answered some of these questions already. It's just that it's kind of nice to talk about it. Okay, so the first question is 3 weeks in finasteride. This is by Jaxley. Sabi niya dito, 3 weeks in finasteride, 1 milligram daily, hoping for good result. Yeah, just keep on taking it. You're taking the finasteride indefinitely. And sabi naman ni Osid Gino, very informative though, good to know. And I pinned his comment. From Leon Recalde, Sir, why don't you try the oral minoxidil instead of topical minoxidil? Nagka-wrinkles daw kasi siya sa topical minoxidil. I don't see the relations. I mean, I don't see the connection with having wrinkles and using minoxidil. Okay, minoxidil doesn't cause wrinkles. Minoxidil, one of the side effect of minoxidil, because it has alcohol content, right? So one of the side effect of minoxidil, it can actually, if you're sensitive to alcohol, it can actually make your skin dry. And you know that if your skin is dry, it can cause, you can actually see it na medyo nagka-crumple yung skin mo. So that could probably, it baka dry lang yung skin niya, or baka dry lang ang skin mo, Madam Lian or Sir. So why I'm not taking minoxidil is because oral minoxidil is not intended to be used for hair loss for both male and female. Oral minoxidil is for blood pressure. Okay. Um, there's no study yet na, or it's not approved. Oral minoxidil is not approved yet to be used to grow your hair. Yes, the side effects of one of the side effects of oral minoxidil is you grow hair in different parts of your body, but hindi siya to be used as a primary treatment for hair loss. It is for blood pressure. I repeat, it is for blood pressure. Pampababa po ng presyon ang minoxidil orally. Okay, so I hope I answered that question. Yeah, I like that question though. So topical minoxidil is FDA approved for the use of male and female pattern hair loss. So tinatanong ni Gosh Dosh, are you on 1 milligram daily? Yes, I am on 1 milligram daily. Not over that, not 1.25, not 0.5, 1 milligram daily for finasteride. Now let's go to Rogelio Refules. Sir, nag-stop ka na mag-take ng finasteride or continue pa rin habang nagmi-minoxidil ka now? No, I'm not gonna be stopping finasteride and I will still continue it while using minoxidil. So I'm using both of them together. And then this is a good question from Lynn. Pwede ba finasteride sa girl? Unfortunately, finasteride 1 milligram or Propecia is only for male. It is intended to be used for male pattern baldness. It's not for female pattern um, baldness. For female pattern baldness, we do have a medication called spironolactone, but it still needs an assessment with your doctor if you are to take that. But for female pattern baldness, you can use minoxidil 2% solution, either by, I think meron silang spray or yung spray or yung solution. And especially ang finasteride, hindi siya pwede sa pregnant girls, pregnant lady, pregnant girls. Ayon. Kasi it can cause teratogenic effects sa baby, okay? It can cause deformity ng bata. Okay, so that's why kung ikaw ay female and you're pregnant and you're handling this medication, you have to have a proper what do you call this? Um, PPE ba ang tawag doon? You're supposed to be wearing a proper gloves and things like that. You shouldn't be crushing it kasi pag na-inhale, it can really cause teratogenic effects sa baby mo. Okay, last question from Edgar Create Channel Ladines. Hello, shout out to everyone. Walang 1 milligram sa mercury at Watson, puro 5 milligram lang. I'm pretty sure that they have Propecia or 1 milligram finasteride sa other pharmacy. Kaya nga, it's very important to get the reseta from your doctor para um, it's very important to get the reseta from your doctor para mas maipakita mo siya sa pharmacist. It's impossible naman na wala silang Propecia 1 milligram. I'm pretty sure na meron dyan sa pharmacy sa Philippines. Okay, guys. I hope I answered some of those questions. Okay, let's move on to a different teka lang. Okay, guys. So I'm gonna answer some questions here, and this is from the video na anti-hair loss product that best supports my finasteride. So I did this, I think, a couple of months ago. Um, Meron ditong isang questions from Jack Shavershan. So this was 2 months ago. Yeah, so 2 months ago kung ginawa yung video. Sabi, you should use a topical finasteride. There is topical finasteride, but I think the research is still in its infancy and yung mga trials niya. So I don't think it's approved yet to be used as an alternative to oral finasteride at the moment. Okay, but kung gagawa sila ng topical finasteride and it will be approved, why not, 'di ba? And if it's okay to be used um conjunctively with the oral finasteride, bakit hindi? And then by all means, let's use it, 'di ba? And this is from Potato Gaming question. Hello, have you used minoxidil together with finasteride sa hair? Yes. 2 months ago with minoxidil and almost 3 years now with finasteride. So I am using them together and I'm very happy about that. Thank you guys for these comments. Juve, nandiyan ka pa ba? Ay, uy, anong nangyari? Si Jeko, si Jubes, laging nandito sa live. Akala mo naman siya yung gumagamit ng finasteride. Jubes, nakagamit ka na ba ng finasteride? It's been, ano ba to, 39 minutes na? Plano niya daw kasi mag-business. Seryoso, ikaw magbebenta, sasabihin mo na it works really good on me. Ay. Guys, sobrang init dito talaga. Like, sobrang init. Grabe. Kakaloka. nire-research ko yung post-finasteride syndrome. So guys, may nakita ako. Um, post-finasteride syndrome. Okay, so basically, ang pagkakaintindi ko, I'm not really familiar with post-finasteride syndrome. Ang understanding ko lang with post-finasteride syndrome is it's para siyang persistent side effects after um after the discontinuation of the finasteride. So basically, if you experience side effect with finasteride, like say rectal dysfunction or low libido, like once you stop the medication, it still persists. So nandun yung parang depression, ay nandun yung parang ano mo, yung nandun pa rin yung side effects. So may binasa ako, may napanood ako actually video that they're saying na parang um the yung ganong klase ng case is actually very small. Okay, parang yung na it's actually a rare case na nangyayari yon. I mean, the benefits are still higher. So, 'pag minsan wala pa naman talagang makapagsabi, um, kung it's actually from the medication or whatnot. Kasi sometimes it can be from a medical conditions, 'di ba? So, medyo malabo ang ano ko ng post-finasteride syndrome since ang side effect naman with finasteride is less than 2%. So, that is my understanding. Pero if you guys are if you guys will go with your, go to your doctor and ask them about post-finasteride syndrome, most likely parang i-disregard lang naman ng doctor yun. Sabihin lang, it's not true or whatever like that. I mean, it's not that it's not true. Side effects happen. Pero the medication, kung may side effect ka, once you stop the medication, you'll go back to your baseline after few weeks. So, mahirap masabi ang post-finasteride syndrome. If you guys know what I mean. Let's read some more questions from other people. This is regarding the ano ba to? Topical melatonin. So this question is actually from Osid Ginao. This is regarding melatonin, and his question is, can I put that on my eyebrows? Actually, melatonin is a good antioxidant. I guess you can put it in your eyebrow. Wala namang issue doon. And it acts as an antioxidant sa iyong eyebrows. Kung manipis ang iyong eyebrows, then i-try mo. Kung wala kang side effect, then go ahead. Kung tumubo, good. Kung antokin ka, good. So, I don't recommend putting melatonin on your eyebrows. Okay, guys. Some people they use what do you call this? Some people they use the minoxidil on their eyebrows tapos para daw kumapal. I'm not sure about that. I think you can, pero pag nagkaroon kayo ng side effect, bahala kayo. Melatonin? Melatonin actually works. Siguro it works good naman for, I think it works good naman for like as an antioxidant, but to have that actual um time frame kung kailan tutubo yung hair mo, mahirap masagot yan, di ba? At least with finasteride and minoxidil, pag sinabi nilang like 3 months mag-work, you'll see an improvements, or 4 months, then you'll actually see an improvements. So, yeah. Okay lang naman na gamitan mo ng ano, antioxidant ang iyong as part of your conjunctive treatments. Anong sabi ni Juve de Grace? Eyelashes kaya? Um, Eyelashes? Gusto mong ipatak yung melatonin sa eyelashes mo? Paano yun? Bumukas yung pinto. Kita na. So, yun guys. Ano 'tong mga 'to? Sorry guys, may tinitingnan lang ako. Okay, so I'm gonna answer some more questions regarding yung mga comments that I get from some videos. Para naman may kaunti tayong lively talks dito, right? So let's go back to the laser and finasteride video that I did. I think it's like 5 months ago, and it got 6,470 views for this video, guys. For those who made a comment dun sa video na yon, thank you so much. I love you all. And I finally reached 1,000 milligram. 1,000 milligram. Anyway, so let's start asking some few questions regarding this video. So may mga nagtanong dito. This question is actually from Res Rai. Her question is my question is, will finasteride work for lifetime for maintaining hair? The question is yes, finasteride is to be used for male indefinitely. Kung talagang if you really want to maintain your hair, you have to keep using finasteride indefinitely. And then another question that she asked was, but I have heard the longest term of use by patients 23 years. So what after that, will it slows down, or will finasteride work for lifetime if you continue to take? Okay, so guys, hair loss, lalo na if you have like male pattern hair loss, ano kasi yan it's a progressive condition. So what finasteride will do is it actually slows down the process of hair loss. Okay, it doesn't mean that you're not gonna get bald. We will still be, we will still end up being bald after, I don't know, after 30 years. Syempre, tumatanda din ang hair follicle. Hair follicles age. Okay? Our circulatory system, it also decreases. Syempre, everything age, guys. Unfortunately, everything age. The medications can only do as much. Okay? It doesn't mean that if somebody's taking a medication that he's free of all these medical conditions and or it won't come back, like say for example those people who's taking a blood pressure medication to treat their hypertension, they have to take that indefinitely. Okay, it doesn't cure that, but it prevents you from having further high blood pressure or further heart conditions. But that does not mean that you're not at risk for heart attack or stroke. You are still, but at least with some lifestyle modifications and changes, and such as diet, exercise, things like that, everything can slow down. Okay, so ganun din siya for hair loss. So finasteride, we have to take it indefinitely kung talagang gusto mong i-maintain ang iyong hair. Okay, so I hope I answered that nicely. Okay, and Meron pa siyang isang tanong dito. She said, she's asking, did you try Dermapen? Because I know one guy who's thinning and recession got his regrowth with thick hairs. I basically mean to say micro needling can give you 80% of better result. I don't use derma rolling. You know those roll that you thing on your scalp? I don't. It is an effective tool, but my advice is that if you guys are planning to do like a derma pen, derma rolling, or whatever you want to call it, go and see a healthcare profession. Go see an esthetician, a certified dermatologist that are well and professional trained specifically for that treatment para hindi kayo magkaroon ng problema. Okay, that I mean, microneedling is syempre needle. Kung gagawin mo siya sa bahay, there is a process of sanitizing it, proper storage and things like that, and we don't have the knowledge to do it at home. Okay, some people they actually use minoxidil with derma rolling, and I've seen results also, but I just personally I don't recommend it to you guys to do it at home. It has to be done by a professional, medical professions, just to be on, like, just to be safe. Okay, I know it costs a lot of money dito kasi sa Canada. I mean, per session, I don't know, I think it's like almost $200, which is roughly around 10,000 pesos sa Philippines, kung ganun nga rin yung like standard price niya. It is expensive, but at least you're safe and you are monitored by medical professions. Alam nila ang ginagawa nila. Okay, guys? Yeah, I don't use derma rolling. I did a video on that, so guys, go and watch it. I think it's like 6 months ago. Go back to my playlist on hair loss. Sabi nila, there's also one question here from Chuck King. Sabi niya, "Hi, great review. I've been using the Hair Max 12 device about 5 months, and I still have the crown like you had before. How much time will it take the crown area will cover with hair like you?" Okay, honestly, with Hair Max comb, I saw the result maybe siguro mga 3 months. I don't know if it's actually from that, but I've noticed that there's some few small hair growth on the crown area, but not so much on the temple area. And I've seen also some few result from other Hair Max users that they've actually seen a result on their crown area, but not so much on the temple area. So I guess um I guess what do you call this? The crown area is much more sensitive siguro, I should say, sa um, lasers. That's why you often get like hair growth on the crown area, but not so. I did not really experience here, but with finasteride, oh my gosh, guys, like I had so much improvements. So another question here is, sabi niya, si Usman Amjad. He said, I am 18 years old and I never had a problem with hair loss, but due to stress of studies about 2 months ago, my hair started to shed very fastly. Now, over 2 months, it has stopped, which I am very thankful for. And now I have comparatively less hair, and I am worried that will the lost hairs recover? Could you answer this for me? And I also have this device at home. So should I use it, and will it improve my hair? So dito from this guy, I think his hair loss is due to stress. Um, so hair loss is I mean, stress, like hair loss related to stress is actually another big factor. And if you know that you're so stressed na sa routine mo, then time for a rest, go for a vacation and things like that. And he's asking if the device will work. It's a good support. It may or may not work, and there's nothing wrong with trying it. It's Hair Max laser comb, or those lasers machine are FDA cleared, so it's safe to be used for hair loss regardless of what type. Um, So there's another question here by Conelo Alvarez. Sabi niya na, boss, hindi na bababalik lahat yung sa temple using finasteride. I've actually answered this before. Yung sa temple kasi medyo mahirap eh. Kasi medyo mas malakas ang ano ng, I don't know, mas sensitive, mas sobrang sensitive kasi siya sa DHT. So, medyo mahirap siya na i-treat yung temple area. But for me, I find that with finasteride, since na early ako nagsimula, it really did help regrow my temple area. So, yeah. So, may nag-question dito kung saan ba daw nabibili yung ano, saan ba daw nabibili yung tawag dito? Yung hair max. So, you guys can, like, I bought it at Amazon. So, yeah. You guys can order it at Amazon. Ewan ko kung may Amazon sa Philippines. I don't think so. But go and check what do you call this? I-check nyo sa Shopee. Shopee ba yun? Sa Philippines? Shopee and or Lazada. Yeah. Guys, may nag-comment dito. Ang sabi niya kung naaamoy mo ba yung finasteride. Kung naaamoy ko ba daw yung finasteride kasi may amoy daw siya, medyo malansa. Ganun ba talaga amoy niya? No. Ang finasteride does not smell, like it doesn't smell anything. Enteric coated siya, wala siyang amoy. Okay? Baka naman peke yung nabili. Walang amoy ang finasteride, wala talaga. Yeah, sa Philippines, I think ang Hair Max Laser Comb is around 12,000 pesos. Kasi dito mga $300 yun. So ayun, I hope that I answered some of those questions. Meron ba sa Shopee? Magkano sa Shopee? Mga 14,000 yun ano? Mga 14,000 siguro yun. Pero alam mo, if you guys are gonna spend money for Hair Max Laser Comb na like 12,000, mag-ano na lang kayo? Bumili na lang kayo ng finasteride. Yes. Okay, ano pang pwede natin pag-usapan dito? Guys, somebody asked me regarding dutasteride. So dutasteride is also another medication that is used to treat benign prostatic hyperplasia. So dutasteride also works the same thing as finasteride. It's just that it is much stronger, I should say, than finasteride. But the only thing is, it is not approved yet to be used for male pattern baldness. It's only used for um, enlarged prostate for men. So, so may nag-comment, can I see your hair? Where? Which part? Anyway, so yeah, guys, dutasteride. I've seen patients that use dutasteride, and of course, we work in geriatrics, meaning it's our specialty area is geriatrics, and these old men patients are prescribed dutasteride kasi their prostate are much more enlarged. And you know what, guys? We've been working with dutasteride for like how many years now, and we don't have any side effects. Wala naman ako nakitang side effects with these patients. So, yes. So let's write it here. Dutasteride. So the dosage is 0.5 milligram. You guys can do your research on that, but of course, it is not used for male pattern baldness. For now, it's still finasteride or propecia. Yeah. But you know what, guys? Let me give you a tip on how to easily grow your hair, like medically proven, okay? So what I did, actually I did a video on this already, but what I did was, if you're experiencing early signs of hair loss or male pattern baldness, syempre, you go and consult with your doctor, right? If your doctor said, okay, you have male pattern baldness, the first thing that you do is ask your doctor regarding finasteride. Of course, he or she will prescribe you finasteride. Syempre, they will check your blood works and things like that. And if your doctor said go ahead, use finasteride, start finasteride, wait for like a year or so, and then once na stable na yung yung hair, once your hair is stabled, go and try the minoxidil. Okay, and then minoxidil will help stabilize it, improve circulations and things like that to your existing hair. So that's what I did. And I also used the Hair Max laser comb and also the anong tawag dito? Yung mga anti-hair loss shampoo. So with anti-hair loss shampoos, there's really no standard shampoo for use of hair loss. Mag-ano lang siya for, it's good for like cleansing and stuff like that. Hi, Ate Mabes! Happy birthday! Ate Mabes, happy birthday! Belated! Good evening! Good morning! How are you? Ituloy na yan. Ituloy na yung baby na yan. Guys, my aunt is here. She's visiting me. She has her own YouTube channel also. Her most of her contents are like Zumba and dancing. So guys, check her YouTube video out. It's right over there. It's maybe Al Qaeda vlog. She dances, she twerks. She actually teaches you how to be sexy. Ate Mabes, if you're having hair loss issues, come to my channel. Yeah, guys, so that's the thing. And always consult with the doctor. What else can I say? Thank you guys so much for visiting. And, if you guys have questions, put it there. I'm willing to answer some questions, guys, based on my experience with finasteride and minoxidil. Guys, you know what? My minoxidil, let me tell you something about this medication, because minoxidil is actually a medication, right? It's a blood pressure medication. So it says here that if you have shortness of breath, difficulty breathing, chest pain, rapid heartbeat, faintness, dizziness, swelling in hands or feet, scalp irritation, or redness, consult with your doctor ASAP. Guys, let me tell you, don't be scared on buying these products just because those side effects are stated on the back. It's just because some patients, or I should say, like, some people do have sensitivities to minoxidil, whether it's orally or topically. So they have to put those cautions on the back just to give awareness to the people that there is a side effect with minoxidil. Also, the most common side effects with minoxidil is scalp irritations and redness. Okay, guys, when it comes to faintness or things like that, it is unlikely, especially with irregular heartbeat. It is unlikely since it is only topical. Okay, you have to consume certain amount of oral minoxidil to have that actual side effects, not topically. It's unlikely with topical. Okay guys, so hindi siya talaga masasabing common for minoxidil topically. But if it's for oral, the chances of those side effects, especially like low blood pressure and feeling of faintness, is, I would say, common. So guys, by the way, again, this is the minoxidil product that I am using. So feel free to check it out. There you go. And by the way, guys, this is not available in the Philippines. I mean, specifically the Life brand. Life brand is Canadian. Okay, but you guys can, of course, find the same ingredient of minoxidil when you go to like SM. Because when I went to SM supermarket in the Philippines, I found that they do have a box of minoxidil in there, and I think it's like 3,000 pesos. So you guys can go and buy and check it out. Guys, it's already, what is it? 1 hour and 10 minutes of talking here, and I'm enjoying it. Jex. Yeah. So, they're asking, actually, a friend of mine asked whether it's actually good to have it's actually, or whether it's good to use a 5% foam or 2% solution. Actually, guys, they're both good. Okay, so whether you use the 2% solution or 5% foam, it's because some people are just a little bit sensitive to the 5% foam solution, so they kind of downgrade to 2% solution. Some people are sensitive to 2% solution, so they use the foam base. And for me, they work good. So for both of them, I would say that the result would be visible after 4 tumasik yung layo. 3 to 4 months of continued use. So sabi dito sa box, you have to use it for twice a day. I only use it once daily, every night. Okay? Kasi sa umaga I sweat a lot. So um I perspire a lot, so the medication will not stay on my scalp for too long. So yeah. Bakit parang ang init? Bukas pa rin ba yung aircon, Jex? Guys, let's talk about the supplements. Like the hair loss supplements, whether do they actually work or not. Personally, guys, supplements are foods. They're just there to supply you if you're not getting enough of that specific vitamins or minerals. Kasi pag minsan, if you're lacking certain vitamins or minerals in your body would actually cause some it will exhibit some problems or things like that. And hair loss is sometimes seen due to like vitamin deficiency, pero unlikely kasi yung mga ganun eh. um what do you call this, when I first started finasteride, I tried like some herbal supplements such as supplemental. I tried it for a year. Actually, guys, it did not work for me. So like talaga lang, it really didn't work. I was still having so much hair shedding with supplemental. um yeah, and then I tried the zinc. Zinc is actually good for your immunity. Pero in terms of hair, I think it's also a good support. Vitamin D is a good hair support. It's an antioxidant. It's boost, it boosts immunity, yung they actually support your um skin proliferation and things like that. But if you really want to counteract, or if you really want to see an improvements with your hair, talagang gamot lang talaga, guys. Like finasteride lang talaga and minoxidil, honestly. I'm so happy that I'm off and I have time to do this. So, how long have I been doing this live? It's been 1 hour and 17 minutes already. Ay, shocking. Jeko, familiar ka ba sa Finasteride and Finasteride?
I know the tester.
Kung familiar ka nga sa kanila, sa mga gamot nila. Huh?
Hey lang, not so much.
Okay.
Alam ko lang anong para saan. Initial for the prostate. That's it.
Pero wala kang masyadong in-depth knowledge of that. So you cannot join in?
Usually, ano lang naman binibigay? The tester. Yung lagi ko nakikita. The tester.
Guys, can you hear the music that I'm playing right now? I mean, can you guys hear it? Hey, Juves! Nandiyan ka pa ba? Okay, guys, so I have a friend here. He's actually also he's also a nurse. So I'm gonna invite him. He's actually playing some games. I'm gonna invite him to come over here because we're gonna go and talk about finasteride together because he does like he knows about finasteride and dutasteride because he works in the hospital. He works in geriatric place. So we're gonna be answering some finasteride questions together based on our experience with using this medication. So, guys, give him a round of applause. O, dito ka dali. Adjust natin yung camera. Sasali daw si Jeko. Ate Mabes, thank you You're so nice. Guys, please, meron din siyang, my aunt also has, as I said earlier, she has her own channel. And I think it's about Zumba and dancing. So it's nice. She makes all those content. And go and check it out, guys. It's her vlog is down there. Down there. It's maybe Al Qaeda vlogs. Go and check it out, guys. So if you guys are interested in like losing weight, staying healthy, staying healthy, looking sexy and whatnot, go and visit her channel right now. It's there. Jeko, dali ko ano mo yung upuan.
Ano ba? I'm playing game.
Saan ka upo? Dito?
Playing games.
Okay, so. Oy, Jubes! Sasali si Jex. So, guys, he's also, kailangan mo ba ng ano? Okay, guys, so he's also a nurse.
I can't contribute anything.
He's a registered nurse in the Philippines. He's also a nurse here in Canada.
Actually, I haven't heard about finasteride.
No, but finasteride is
when I was in the Philippines. Maybe I guess it was as for hair loss. I mean,
hindi sa hair loss.
Maybe because it's not. I don't think Philippines are really investing on or getting propecia to treat hair loss. I believe na yung mga tao na nagsasabi na, oh, I really can't find finasteride. I think that's a possibility kasi parang, I don't know. Feeling ko lang na wala talagang 1 milligram na finasteride sa Pilipinas.
Ay, by the way, Jubilin de Gracia. Sawadika.
Sawadika, Jub de Gracia.
Saway Makloy. Okay, guys. So, my friend was saying like in the Philippines, finasteride is a medication that is not well advertised for hair loss.
Mm.
And a lot of people, aside from that, one factor is that in the Philippines, consultation is very expensive.
Yeah, first of all,
First of all, the
consultations.
consultation is
Okay.
very expensive. The medication itself is very expensive. Seeing a specialist is very expensive. And aside from that, the medical system in the Philippines is not as so universal compared here in Canada. In Canada, you can go to any doctors without having to pay even a single penny. Okay, so that is one factor na kung bakit maraming mga tao sa Philippines ang hindi familiar with finasteride. Unlike here sa Toronto, I mean in Canada in or US, it is very it's easy to obtain this medication kasi of the support of the government. And aside from that, when you look at the Asian community, hair loss is actually not as a big problem compared to the Western countries like Canada, di ba?
Yeah.
Yeah, hair
Yeah.
loss in Asian
So, kasi
community.
sa jeans din yan, diba?
Yeah. Like if you are to compare, let's talk about Filipino people sa of course, like back home and dito sa Canada, I've seen a lot of Filipino people dito sa Canada who actually are losing their hair compared doon sa Philippines on that same age group. Di ba? So yeah, guys, regarding the tutasteride, we know this medication. We give this medication to patients with benign prostatic hyperplasia. Not
Anything with like
yeah.
prostate problem, I would say.
Pero did you actually experience any side effects? I
I
mean, did any of your
the
patients
patients like
complain side effects with the use
no, I
of
don't think
dutasteride,
I don't know. Maybe not. Maybe ano
like
na.
depression?
Well, I really can't say because I'm taking care of, you know, in a geriatric medicine unit. So most of the patients are really kind of like they came in with confusion or they have dementia or things like that. So I really can say it's
What's okay.
because of taking the tasteride or finasteride. You know, it's hard to tell that it's the medication that's been causing that medication. But if you're because these patients are taking this medication not for hair loss, they're taking this for their prostate,
Yes.
right? So I don't think they're gonna care that oh it has like side yeah depression side effect or I don't know. I don't think it's that's their concern or
Mm-hmm.
they're at their age where their main focus is on keeping their self healthy. I don't think it matters to them like oh maybe I'm not gonna get erectile dysfunction. They're like maybe at 80s or 90s, so they would care less about having
Yeah. So
a
those I would say like
decreased libido. I don't know.
I would say like those
Me?
people
I don't know.
kasi one of the most common side effects of finasteride or dutasteride is erectile dysfunction and low libido. Our work of specialty is in geriatrics. So mga matatanda na yung mga nandun and a lot of them have diabetes, depression, they have a cognition problem, they have mental disorder. So it's really hard to tell if that is actually from the cause of finasteride. And um, those people who actually uses finasteride specifically for hair loss, they would think um, since that they're so concentrated on their hair loss, they think that finasteride is actually causing the problem, while instead it's actually caused by an underlying medical condition. So gaya nga nung sinasabi namin that finasteride side effects is actually less than 2%, which is in fact true. Mahirap naman talagang masabi. So halip na sabihin mo na ang depression is caused by finasteride, the doctor has to go deeper to see if it's really the medication that's causing it. So, but so far, wala talaga akong side effects. So, that is our experience with the dutasteride and finasteride na binibigay namin. Di ba binagbibigay tayo ng finasteride 5 milligram?
Yeah, usually actually hindi ako masyado nakakakita ng finasteride PO. Oh no, it's PO but it's in a liquid form. Like it's in
Yeah,
a
we do actually, guys. Let me tell you,
ano,
we also
naka-liquid
have
form siya. But the finasteride, yun nakaano siya, parang
we
caplet
also
siya.
have finasteride liquid
Naka-liquid
5
siya.
milligrams. So that is also another form or form ng finasteride is actually liquid. I was very surprised to see this, but this is specifically for benign prostatic hyperplasia and not for hair loss, guys. Okay. So those people na those patients that are taking finasteride liquid 5 milligram for their benign prostatic hyperplasia, they're not only actually they're treating the prostate, they're treating the enlargement of the prostate, and aside from that, they're also improving the looks of their thinning hair. Pero kasi mga matatanda na yung mga nandun, it's a geriatric, it's the general population is geriatric, so unlikely that you'll see an improvement with their hair. So, dun sa mga matatanda that they have the hair over here, yun lang talaga yung makikita mong hair growth. Di ba?
Hmm.
Ay, yun lang yung nakikita mong maintain ng hair.
Possibly. I don't know. I didn't really, mind na mag-check na, oh, this patient is taking the finasteride. Oh, maybe I should check their hair.
Yes.
It's wala na sila dun na stage, I guess,
Mm-hmm.
na they care much about their hair. See, I don't know.
Yeah, usually the younger people are more into their
Maybe if you're like 30s, 40s, and 50s, possibly, but pag naka 80s, 90s ka na, 70s, 80s, 90s, I don't think
mm-hmm.
na you'll still like,
Sawadika, Jube, the Grace.
Sawadi!
So, what else can we say about finasteride? Actually kasi ang ano namin, I mean, we use finasteride a lot in the workplace pero kasi dun sa special nga as I said dun sa work of place namin, hindi talaga siya for the treatment of hair loss. It's into a much more serious medical condition which is enlargement of prostate. And guys, a lot of people na for men na 50 years old and above, talagang yung kanilang prostate is so enlarged, guys, and they cry out of pain lalo na pag hindi sila makaihi. Kaya mas mura ang finasteride 5 milligrams sa Philippines because I think it's 5 milligram is really not for the use of cosmetics. 'Di ba?
Kaya mahirap maghanap.
Oo.
Yun. Wala, hindi siguro the big pharmaceutical, no, not pharmaceutical, but big drugstores like Mercury Drugs or
Yes.
Watsons don't carry those medication. Um, like finasteride, it's because I don't know. It's like I don't know. 1% of the population is like really looking for it. Rarely looks for it.
Mhm.
So it's like siguro for them it's like a waste of getting those medications kung wala namang actually bibili.
Yes.
I-invest na lang instead of buying those medications. We can sell different antibiotics na lang or pain medications. Yeah,
Mhm.
kaya I understand na some of the viewers, some of the na nagsasabi na, oy, can you use just 5 milligrams of finasteride and tapos kakat mo na lang, which is not ideal kasi it's still overdosing, right? But so, I don't
Yeah,
know. I don't know.
I don't really advise cutting the 5 milligram into 4 pieces kasi overdosing talaga yon. Even it's a 1.25, kahit over siya ng 1.20, I mean, kahit ano siya, kahit over siya by 0.25 milligrams,
Mm,
consider na overdosing pa rin yan in medical,
mm,
ano, no?
mm.
Yeah. only the doctor can actually agree. Like as a nurse, we cannot push you guys to say go ahead and take the 1.25. We follow the doctor's order. Then the
Yeah. Yeah,
doctor's order.
try niyo na lang pumunta sa ano, sa better just go to the doctor, ask the doctor kung, if okay lang ba na may 1.25 kasi nahihirapan ka nga bumili ng 1 milligram ng propecia na finasteride.
Mhm.
So try mo na lang i-ask if the doctor says I guess it's okay, then go ahead.
Yes.
Then go ahead. Maybe try mo na lang, like for example 125, then you start with every other day.
Mhm.
Pwede siguro yun. Like you take finasteride every other day. Siguro at least pwede
Okay.
naman ata yung makipag ka deal ka sa doctor mo.
Mhm.
Like instead of taking it every day, because since you're taking 1.25, maybe you take finasteride every other day.
What
Would
can you
that
say?
help?
What can you say about one? There was one viewer. He asked me that yung amoy daw ng finasteride is malansa. Guys,
Mabaho ba?
honestly, hindi
Hindi ko
talaga
alam
mabaho
eh.
ang finasteride, guys.
Hindi ko alam eh.
Wala talagang amoy. It's enteric coated. A lot of the
Wala
enteric
naman
coated
eh.
medications doesn't smell anything. Ate
I
Maybe,
don't
how
know.
are you? Thank you
I
so.
don't know. Wala namang amoy. You don't smell anything.
Yeah. What can you say about Maybe Al-Qaeda vlogs?
Hindi ko naman alam yan.
Guys, follow her. She likes Zumba and stuff like that. So yeah, by the way, it doesn't smell anything. It's not malansa. It's enteric coated, guys. Look.
Baka yung finasteride yun na yung
Can you guys see?
hindi nagpo-focus. Maybe I need to get out of the camera.
No, okay lang yan. Yeah, see,
Yan,
can you guys
see?
see? Enteric coated siya. It doesn't smell anything. Yeah, so and regarding the finasteride nga pala and dutasteride, bawal ang buntis na humawak ng gamot na yon. Okay? Kasi baka ferrosol kasi sorry, na disturb ako by Jube de Grace comment. Kasi ayun nga, 'di ba makaka-cause ng teratogenic effect?
Yeah, may teratogenic effect siya. So even when giving it, they always put a comment
Yeah,
there
laging may
na
comment dun sa medication.
wear double gloves when handling this medication. Cause it can cause infertility and stuff like that.
Mhm.
May precaution siya when handling the medication.
Yes. So that is our overview with the dutasteride. That's our experience with the dutasteride and finasteride with our patients, 'di ba? What can you say?
Wala. Continue.
Continue on taking it. It's a safe medication, guys. You guys want to see the result of my hair right now? That's the result. Actually, maganda nga yung hair ko ngayon, yun. O, 'di ba? Ano na siya?
Dito sa baba.
Pangit.
Hindi. Yan. Makapal na. Dati, ito, yan, may laking space yan dyan.
Hoy, not so big.
Hindi nga, pero halata mo may space dyan dito sa gitna. Dito, yan dito from yung mo dito. Anong tawag dyan? Yung mo ng buhok.
The crown area.
Yung from one end to end, yung points niya dyan sa hair mo.
Sabi ni
Anong tawag dyan sa English?
the crown area nga.
Crown area mo is here. Ibig ko sabihin
yung puyo?
Yung puyo mo. Anong
Guys,
tawag
what's puyo in English? Puyo. Puyo. How do you say puyo in English? Guys, by the way, I bought a new hair conditioner that I have been using for like a long time. And Thank you, Jeko, for joining in.
Okay, bye.
He has to do something. Dalawa ang puyo, sutil. So guys, what do you call, how do you guys say puyo in English? Okay guys, this is the conditioner that I just bought. This is my third bottle. So, ayan siya. Oh. It's a good deep cleansing and ano ba to? Deep cleansing and cooling conditioner. So I got this one at TNT Supermarket. And maganda talaga siya, guys. It's very nice, very cooling, very refreshing. Okay naman siya, hindi malakas maglagas yung buhok ko. Jubes, pakinig ba yung music nung ano, yung background music o hindi? Ano yun? Oh shit, hindi ko alam may mga ganyan. Wow. Jubes, pakinig ba yung music? Whirl. Whirl ba? Whirl. Whirl daw? Whirlpool. Seryoso? Whirlpools? Whirlpool. Kasi dalawa yung sa akin, the whirlpools. Hoy, kung pakinig nga yung background music. So yeah, guys. It's almost for 3 years na yata akong gumagamit ng Finasteride and so far it's good. Sorry guys, I'm eating something. Guys, pa-shoutout daw sabi ni Jube de Grace sa kanyang mga sinampay at kasi tapos na daw siya maglaba. At saka may kuryente na daw. So, shout out to that. Hindi na maglalagas ang buhok mo sa stress. Ang cute naman itong mga emojis na 'to. Sorry, I'm just playing around with the emojis. May mga ganto-ganto talaga. Oh, 'di ba? Oh. Oo, may mga ganyan-ganyan ano. Nasaan si Kirk? Mag-answer pa nga tayo ng mga questions dito. Maghanap tayo ng ano. Okay, guys. So let's start asking some few questions here. Um, Sabi dito, can I take biotin 10,000 microgram and multivitamin Enervon a day? So I'm pretty sure na Enervon is a Filipino supplement, di ba? Wala naman talagang proof as I mentioned in my other videos na wala naman talagang proof ang biotin that if you take biotin you will regrow your hair or prevent hair loss unless you are deficient with biotin. Pero ang biotin deficiency is actually very rare. Okay? So, hair loss as related to biotin deficiency is rare. Kaya, I kind of don't, I mean, the studies with biotin is, it's lacking. What about collagen supplements? Collagen supplements are, of course, a great support also for your skin, hair, and nails. Maganda siya sa it helps repair, um, mag-repair ng ano ng skin. It's a support for your muscles din, mga ganyan-ganyan. Pero really for hair loss, okay lang. I mean, try it. It's a good support. May nag-comment pa nga dito sabi, I'm I'm with biotin for a week pero mas lalo naglagas yung hair ko. Biotin is a water soluble. I don't think isa sa mga side effect ng biotin like consumption is hair loss. The reason why you're taking biotin for that reason is kasi nga gusto mong improve yung hair loss mo. So I think with that, since nasabi niya 1 week pa lang daw siya nagtitake ng biotin and side effect niya is hair loss, I don't think it's because of biotin. It's because of the fact na talagang you're on that stage of hair loss. So progressive ang condition na yan. So that's the one. Biotin supplement, you don't need a prescription from your doctor. You can get it over the counter unless otherwise kapag nagpa-check up ka sa doctor mo, sabi ng doctor mo na deficient ka sa biotin, re-resetahan ka ng doctor. So yes, those are some of the questions that I got from my biotin videos. Hindi ko bukas mo yung aircon, ba't parang ang init? Grabe nantok na akong aga ko tong ano ba oras na ako nagising? 12? 12 na yata. Du. Binabasa ko yung sa post-finasteride syndrome eh. Okay guys, it's already an hour and 50 minutes. I may have to stop over here. I really had good time with you guys. Thank you so much for coming and joining in. And so I basically just answered some few questions from my previous videos, and it was really nice actually. Yeah, so I'm gonna do another live video. I would say like maybe I don't know, next month, September. I don't know if I can actually do a live video when I go to the Philippines. I'm going to Philippines in October, guys. So I'm gonna make some few contents over there. So mag-enjoy tayo sa Philippines. By the way, nag-change yung aming flight back to Toronto from Philippines. So halip na November 19, naging November 20 ang aming balik dito. So that is something. So kailangan ko tumawag sa trabaho para sabihin sa kanila na may adjustment sa aming flight. And the first time I will be going to Davao City with my cousin, Juve de Grace. Juve de Grace, kasama ka ba? Sasama po si Juve de Grace sa Davao City. Mangangain po siya ng durian. Ready na ang two-piece. So, siguraduhin mo yan ha. Ilalive kita sa araw na yon. Ilalive ko ang iyong two-piece. Maganda yung game.
Kumaintin niya.
Si Ate Maybe. Ate Mabes, congratulations on your 1,000 subscribers sa iyong YouTube. And I hope that you're close to getting your channel monetized. So guys, i-follow nyo siya. Kapag napanood nyo tong video na to, itong live streaming na to after it's posted, panoodin nyo ang kanyang mga sexy dance and very provocative outfit, ta kanyang mga sexy clothes. Oo nga. I know, ano ang tawag doon? Yung WH is actually isa yun sa pinakamahirap na magawa, Diyos ko po. Kailangan mo talaga mag-upload na mag-upload na mag-upload na mag-upload na mag-upload to ano, para makuha mo yung watch time hours. Mahirap yan, pero okay lang yun. Enjoy, enjoy lang. YouTube is not an overnight miracle. It's very slow. Pero okay lang yan basta na-enjoy mo and you're having fun. And I like your videos actually. Oy, Jubes, si ano ba, si Kirk, is he by any chance of any plans to use minoxidil? Di ba sabi ko nga sa kanya that he needs to use minoxidil? Sabi ko nga sa kanya, gumamit siya ng minoxidil. Awa naman ng Diyos at nagkakuryente na kayo dyan sa Mindoro. Ano ba yun? Seryoso? Guys, tomorrow I am gonna go to Shoppers Drug Mart to buy another box of minoxidil 2% solution. Last time I went there, they don't have the minoxidil anymore. They ran out of the 2% solution. They only have the 5% foam. But I did not, I don't want to take the 5% foam because it's kind of expensive. For like 3 bottles, it's like $97. So, yeah. So do you guys have any more questions for me about my experience with minoxidil and finasteride? If so, just comment down below. I can stay here for I don't know how many hours. It's fine. I'm off tomorrow. So I do have the time with you guys. I know I said earlier that I'm gonna go, but it's okay. I'll stay for a little bit. Kaya yon. I was busy with my school and work. And so my editing process with my videos are very slow. But my next content will be skincare. Pahinga muna ako sa ano guys, finasteride and minoxidil until I come up with a content. So you guys have to go and help me with the content. Tulungan niyo ako. Hi JR Vlogs, how are you? Thanks for coming in. Yeah, minoxidil is very, very effective for hair growth. My question is, are you currently using minoxidil? Gumagamit ka ba ng minoxidil ngayon? And if so, what percentage? 2% or 5%? Not yet? Okay, but are you on finasteride? Oh, okay. Yeah, alam mo, ang maano ko, ang may advice ko, if you have the chance to consult with your doctor, magpa-consult ka na kaagad habang may active hair follicles pa doon. Nang sa ganon, if the doctor will prescribe you a finasteride, very effective yan. As in, sa loob ng 3 months, makikita mo talaga yung improvements with your hair, and then maghintay ka ng mga 1 year. Pag nag-stable na yung hair mo, then gamitan mo siya ng minoxidil. And I'm telling you, that strategy that I did, so kung hindi mo pa napapanood yung video ko, doon sa naghintay ako ng 2 years bago ako mag-take ng minoxidil kasi nag-focus muna ako sa finasteride. Yung strategy na yun nag-work talaga sa akin, and like seriously, sobrang like kumapal na talaga yung buhok ko with that. So as you guys can see, effective yung ginawa ko na finasteride muna and then minoxidil. Thanks for coming in, by the way. Nasa may bare area? Totoo po ba yung hair na nasa may bare area? What do you mean? Like, you mean on my temple area dito? Dito? Kumapal na nga yung sa thin area po. Yung you mean yun sa may temple area? Is that what you mean? Actually noon, yung as in noon talaga yung buhok ko talagang depressed na talaga ako, seriously noon. Parang katapusan na yata ng mundo ko noon eh. Pero okay naman, like talagang yeah, usually kasi kapag sa male pattern baldness, talagang yung dito mo, madali talaga siyang mag-thin out. Yun yung nauuna eh, yung dito at saka yung dito. Pero habang gaya nga na sinabi ko, hanggat agapan mo kaagad, inuman mo na kaagad yan ng finasteride kung i-approve sa'yo ng doctor para maagapan mo. Kasi napakabilis talaga ng hair loss. I'm telling you. Tapos anuhan mo na siya na kaagad ng minoxidil after few months or a year or so. Diego, meron pa tayong Nesty.
Wala na.
Echo, parang gano'n.
Wala na din.
Wala na tayo.
Hindi naman tayo bumili.
What doctor nag-specialist hair po? Ang nag-specialist sa hair is dermatologist. Okay? They specialize doon sa skin, hair, and nails. So, kung gusto mo magpa-consulta sa dermatologist, why not by all means pumunta ka? Much better. Para maresetahan ka nila ng gamot. Trichologist? I'm not so familiar with Trichologist, okay. Meron akong pinuntahan nun na trichologist pero parang iba naman kasi yung parang treatment nila. So, like usually pumupunta talaga kami sa family doctor or dermatologist kasi sila yung mas parang mas may experience talaga dun, 'di ba? So, yeah, I suggest na pumunta ka talaga sa actual medical doctor na may specialize sa skin, hair, and nails. And that's your dermatologist. Try ko. Yeah, kahit dito sa Canada, hindi naman masyadong common ang trichologist. But trichologist is din sila actually. Specialized din talaga nila ang hair and scalp. Dermatologist is a medical doctor, but I'm pretty sure that dermatologists are much more broader. Parang mas malaki yung sagap nila. Oh yeah, oh yeah. Pwede po ba yung mga dermatologist sa mga dermaskin clinic? Pwede naman basta meron silang mga treatment for specifically for hair. I'm pretty sure kung may mga treatment sila for hair, specific treatment for hair, then pwede kang mag-ano doon, pwede kang magtanong sa kanila. But a lot of times naman kasi pag sa dermatologist, meron silang pwede ka nila matulungan for that. Pwede din, basta meron lang scope din nila ang hair. Ang right now, yung finasteride na tinitake ko is 1 milligram. 1 milligram daily. So, 'di ba nga may 5 milligram din pero hindi 'yun for hair loss. 1 milligram lang siya and you take it every day. Yeah, you take it every day. Ako tinitake ko siya every night kasi mas effective siya not effective pero 'yun lang yung yung okay na oras sa akin para i-take siya is at night time. Yeah, so yun yung aking experience with that. And okay naman yung finasteride guys. So don't forget to take nyo siya. Biotin, gaya nga nung ginawa kong video about biotin. Biotin kasi hindi siya effective actually for hair loss. Um, Hindi siya effective to prevent or to regrow hair kasi nga ang biot kapag may hair loss ka gawa ng biotin deficiency, very rare 'yon. Hindi siya common na sakit ngayon kasi yung may mga kinakain natin is may biotin na, 'di ba? So, it's unlikely na ang hair loss is due to biotin deficiency. So, I would say na hindi effective ang biotin for hair loss. Yeah, no, hindi effective ang biotin. Biotin is not effective for hair loss. Kahit yung mga shampoo na biotin, hindi talaga siya effective. So thank you so much for all your questions. I think I may have to stop here. And tomorrow I have to wake up early kasi um, may appointment pa kami sa doctor. Meron akong phone consultation tomorrow with my family doctor kasi tatanungin niya uli ako about my finasteride tapos bibigyan niya ako ng bagong refill ng medication. So, kakausapin ko siya about that. And I'm so happy na I will have a new finasteride medication uli. May nabili akong pang hair fall, walang effect. Yeah, usually kasi yung mga herbal supplements, herbal solution, herbal shampoos, hindi naman talaga siya effective for hair loss. Maganda lang ang mga shampoo and conditioner na may anti-hair loss to, cleanse, give moisture, para laging malinis yung scalp, which is very important din for hair growth. Pero it's not really doing anything doon sa main source ng hair loss, which is DHT, lalo na sa male pattern baldness. So, kailangan mo talaga mag-finasteride. No, 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 no. Merong side effect ang finasteride pero less than 2% lang naman siya. So maliit ang chances na magkaroon nun unless meron ka mga medical conditions such as depression or meron ka ng erectile dysfunction, diabetes, high blood pressure. So kung may mga medical conditions ka tapos nagtitake ka ng finasteride, a lot of times ang nasisisi is yung finasteride. In fact, na yung ibang medical condition also causes uh, low libido or erectile dysfunction. So yeah. I've been taking finasteride for like 2 years now. Almost 3 years na. So far very effective yung gamot. And I'm happy that I have taken the finasteride. Currently, my treatment is still finasteride. That's like my my everything, the finasteride, and then I have the laser hair max, which I just do it occasionally because I'm too lazy to use it. Tapos meron akong mga yung anti-hair loss shampoos, like herbal shampoos na ginagamit ko, yung Sika Peptide Anti-Hair Loss. So I did a video on that. Go and check it out. Tsaka yung minoxidil, which I just recently started 2 months ago. So far it's good. I think it's working well, but I still have to see because it's still early. It's only like 2 to 3 months. So usually with minoxidil, you'll see the result in like um, 4 to 6 months, like that. Yeah. Okay. Anyways, guys, I'm gonna go. It's already 10 p.m. I'm gonna prepare to go to sleep and do some other stuff. Kita-kita na lang ulit tayo on my next month of live video. So, guys, again, thank you so much for watching, and I really appreciate you guys coming in here and asking me some questions. I'll continue to make more skincare and hair care videos. So, guys, don't forget to give it a thumbs up, turn on that notification bell, and share it with your friends and families. And meron pang pahabol na questions eh. Wait lang. Ano po best nyo sa nag-start ng mag-thin ang hair? Okay, my best advice kapag napapansin nyo nagti-thin ang hair is really to see your doctor muna. Magpa-check up ka muna. Magpa-check up ka muna sa doctor. This is not only for you, but this is for everybody whose concern is hair thinning. The best way is to really consult with your doctor first. Pa-consult ka muna sa doctor. Okay, para ma-check ni doctor kung ano ba talaga ang cause ng hair thinning mo. Kasi as I said in a lot of my videos, na ang hair loss is caused by a lot of factors such as genetics, number one, stress, diet. It can also be caused by medical conditions such as if you have like diabetes, nakakatindi nyo ng hair, thyroid problems, anemia, kung mababa ang ano mo, hemoglobin mo, and you have anemia, nakaka-hair shedding din yon. Kung nakagamot ka, like a chemotherapy drugs and things like that, nakaka-hair loss din yun. So, kailangan mo muna magpa-consult kay dokta. Okay? Tapos, kung sasabihin ng doctor na male pattern baldness siya, re-resetahan ka ng finasteride, you take that every day and just wait for 3 months to 4 months until you see improvements. However, if you don't have an improvement within the 3 months or 4 months, bumalik ka kay doctor mo, sabihin mo kay doctor na hindi nag-i-improve ang aking hair. So, that is the best way talaga. And wag ka munang bumili at wag muna kayong bumili ng mga products without consultations with your doctor kasi unang-una, nakaka, ano siya, unang-una is magastos. Pangalawa is hindi mo alam kung ano ba talaga ang ano ng hair mo. And also, medyo risky ang mag-take ng herbal things or supplements without doctor's consultation. So, that's it. Kung gusto niyo na maging successful ang inyong hair loss, consult with your doctor first or your dermatologist. Okay, guys. So, anyways, thank you so much again, guys, for watching. Oh yeah, definitely babalik ang iyong hair. So, thank you guys again for watching and I'll see you again next time on my next videos. Bye-bye!